First of four across the country, healthcare providers are grappling with a shortage of IV fluids. This comes as the nation's largest supplier continues to recover from Hurricane Helene. News 8's Demetrius Sanders joins us live in studio. He has more on how the shortage is affecting West Michigan and what's being done to limit its impact. Demetrius?
Well, healthcare leaders say this is not the first time an IV fluid shortage has been caused by a manufacturing facility being in the path of a hurricane, but the last shortage was not of this magnitude. As Hurricane Helene swept through western North Carolina in late September, flooding caused Baxter International's North Cove plant to temporarily close. The facility supplies around 60% of IV fluids to hospitals nationwide.
That doesn't mean that they make 60% for every hospital. Some hospitals are not customers of Baxter, and so this has minimal impact on them. Other customers use much more than 60%.
The pause in production leading to a shortage of resources.
What most people are probably familiar with having an IV is for using that to move the medication that you need into your body.
On their website, Baxter says more than 2,500 workers at their North Cove plant are returning to work, and they'll restart production in phases through the end of the year. In the meantime, Apple says Michigan healthcare systems are making adjustments.
I would say that with few exceptions, I believe just about every health system in the state is doing what are called conservation measures.
That includes right here in West Michigan. In a statement, University of Michigan Health says they anticipate a supply shortage, writing, quote, Baxter is not our only supplier, but to address expected shortages, we have instituted multiple conservation measures to optimize our current supply, such as not using infusion bags for non-clinical purposes and avoiding initiating fluids on patients for whom there is another clinically appropriate option. Corwell Health also commenting, we are closely monitoring the situation. We are confident in our ability to meet patient needs at this time. We are in regular communication with Baxter and are encouraging our teams to conserve IV fluids when possible. To also address the issue, Baxter has received approval to import IV fluid products from its international plants.
Over the weekend, the federal government expected to see air traffic with supply on it from those offshore countries.
And she says she's encouraged Baxter is making progress and has not heard of medical facilities in Michigan having to postpone procedures because of the issue.
Anyone who's concerned about whether or not everything is okay, where they're scheduled to have a procedure in the next few days, that they would reach out to that facility.
Now, I also reached out to Trinity Health about the shortage. They say they do not expect a significant impact in the short term, but they are monitoring the situation. Rick?